and welcome to Docplexus News. After the state government called on the Essential Services Maintenance Act to end the junior doctors' strike in Bhopal, 1,200 of the doctors have resigned. The doctors' strike was in demand of hike in their stipend to Rs 20,000 per month and better work environment on rural posting. As a result of this mass resignation, the patient service in Bhopal has been badly impacted. The IMA, along with the Tamil Nadu Orthopedic Association and National Law School of India University Bangalore, have jointly drafted a model patient consent template. The intention behind creation of this draft is to minimize the confusion among doctors due to absence of uniform patient consent template. It is believed that this consent template may benefit the doctors and avoid unnecessary panic due to legal issues. Researchers from Hudson Institute of Medical Research, Australia, have discovered a hormone follistatin which reduces renal damage in lung cancer patients. Use of follistatin has been found to be safe in making chemotherapy effective. Follistatin hormone also has less potential for toxicity as compared to other drugs. India contributes to nearly 60% of head and neck cancers worldwide. According to a clinical study presented at the annual conference of American Society of Clinical Oncologists, nimotuzumab along with chemoradiotherapy might be an effective treatment against head and neck cancers. This molecule can improve treatment outcomes on factors like progression, disease-free survival, and duration of locoregional control. After reviewing 349 fixed drug combinations, the Drug Technical Advisory Board has recommended that 343 of them should be prohibited, while the remaining 6 should be restricted or regulated. The report would be sent to the Health Ministry, following which the fate of these drugs would be decided. Researchers at the Indian Institute of Public Health, Hyderabad, are working on developing a drone delivery system for medical products. Medical products like blood samples, vaccines, and medicines would be transported easily using drones. This delivery system is thought to be cost-effective and time-saving in comparison to road transportation. After the deadly Nipah virus outbreak that infected many people, the government is planning to come up with a policy to control hospital-acquired infection. The government is planning to implement this policy initially in the government hospitals and then extend it to the private clinics. The IMA has expressed its deep concern over the fake medical content circulating on the social media platforms. According to IMA, the government and the social media companies should take proper steps to stop this. These fake messages reaching people are refraining them to avail treatment for the disorders. First week of August is celebrated as World Breastfeeding Week annually. WHO and UNICEF have launched the Baby Friendly Hospital initiative in maternity and newborn services worldwide. This initiative aims for an effective implementation of 10 steps to successful breastfeeding. These 10 steps are: communicating breastfeeding policy with healthcare staff, training healthcare staff to implement policy, discussing the importance of breastfeeding, supporting mothers to initiate breastfeeding within half an hour of birth, assisting mothers to initiate and maintain breastfeeding, informing mothers not to give food or drinks except breast milk unless medically indicated, allow mothers and infants to practice rooming in 24 hours a day, encouraging mothers to recognize infant demands for breastfeeding, counseling them to avoid the use of feeding bottles, teeths, and pacifiers, and referring mothers to breastfeeding support groups. Please share your insights on this guideline by WHO and UNICEF by commenting below. These were the latest happenings in the medical field. brought to you by Docplexus, one of the largest online communities of doctors. Stay tuned for more every Thursday at 6 p.m. Happy Docplexus!